We are so very grateful to Senators Murphy and Blumenthal for joining us for this Eyewitness News special report. There's never been anything like this in our lifetimes to compare what's going on now. We hope that we never see it again. I want to ask you one thing we've kind of learned. I think a lot of Americans, I was kind of shocked that so many medicines are made in China and so many ingredients in other healthcare products are made in China, and now we can't get it. And I'm wondering if you think that there should be more of an effort going forward to make these products in the United States.
Absolutely. I think we have to start looking at medicine as a national security asset. And we're fortunate in the sense that China was able to get over the hump relatively quickly. And so you're not going to see as much suspension of production of medical equipment as we might have feared. But it's a wake-up call to the United States. I've been one of the leaders on the Buy America movement for years. I think we should just be making a lot more stuff here in the United States. And this is an opportunity to assess what the critical drugs are, make sure that we have at least the capacity to make them in the United States, even if we're not making 100% of our supply here. Let's make sure that at least on the drugs that are critical to maintenance of the healthcare system, we can make them in the United States. Personal protective gear has to be on that list as well. I think we're going to really have to have a reckoning with how dependent we are on a global supply chain, because whether it's a pandemic or, frankly, a diplomatic or military row with another nation, we are exposed when we can't make so many life-saving goods here in the United States.
And I just want to add, Chris is absolutely right. We are too dependent on the supply chain in terms of pharmaceutical drugs, but we're also too unprepared generally. This shortage of medical supplies and pharmaceutical drugs is nothing new. For 10 years, literally for 10 years, at Hartford Hospital, all around the state, Jeff Flax has been a great champion. I have highlighted this issue of the shortage of workhorse medicines like insulin, anesthetics, other kinds of pharmaceutical drugs that are not only priced too high, out of the reach of many Americans, but they are also in desperately short supply, and that is a scandal.
We had a viewer question earlier for Governor Lamont, but it might be suited to you too as well. What can we do in terms of talking to banks about doing something about letting mortgage payments slide? Because there are a lot of people in Connecticut who are losing their jobs this week and are really worried about paying their bills.
Bank of America, I think, just announced maybe an hour or so before we went on the air that they are going to engage in broad-scale mortgage forgiveness, or at least delays in payments. We need to look at whether there's an ability to get our Republican colleagues to support federal legislation that will do that. But we're going to have to look at a broader array of measures. It's not just forgiveness on mortgage payments. As Dick mentioned, it's student loan forgiveness. It's going to the credit agencies and telling them that they have to suspend downgrading of credit ratings for a period of time. It's getting the health insurance companies to take the co-pays off of coronavirus treatments. Listen, I would much rather the private sector do this voluntarily, but if they're not willing to do it voluntarily, then we've got to look at national legislation. And we're better off doing those kind of things nationally rather than requiring 50 different state legislatures to do it.
There are some saying that this economic downturn, this coronavirus effect is going to be like the Great Depression. It's going to take us years to dig out of this. Do you believe that?
No, I really believe, call me optimistic, that we are so resilient and resolute as a country that we will come out of it more quickly and strongly than a lot of the naysayers are predicting right now. And the reason I think it is because precisely people are aware of the threat, and we are coming around in a very bipartisan way to the idea that we have to work together. These two bipartisan bills are only the first steps. We need a third and a fourth and a fifth. What we have to fear is indeed fear itself, reflected in the market's volatility. But we're the United States of America. We can produce more ventilators. We can produce a vaccine. We can make sure that there are bridge loans or grants for small businesses, that there's no blank check giveaway, sweetheart deal with a big corporate interest, and make sure that we temper whatever we do with protections for workers first. And I think we've learned some lessons from the past bailouts, from the past recessions that we can put to work here.
When will things be back to normal? 6 months, you think? 4 months? A year?
I think 6 months is probably optimistic, but I'm hopeful when we certainly celebrate the new year that we will have a lot to celebrate.
I mean, this is in part dependent on all of us, right? I mean, this is an epidemic that is not controlled just by the government. We are certainly the most important players here to make sure that we survive, and citizens and the healthcare professionals out there have the tools to beat this virus. But if everybody makes the decision to follow CDC recommendations, wash their hands, engage in social distancing, telework from home when possible, avoid large crowds and gatherings, together we can turn the corner fast. We watched China and South Korea do it. We can do it too. And so we've got the primary obligation, no doubt, the governor as well, but everybody has a role to play.
And here's a really important point. If you're left with nothing else, we need to confront the medical crisis, even as we go big on the economic crisis. If people are not cured of this disease or prevented from having it, if they feel that it's unsafe to walk in the streets, to go to the grocery stores, to meet with friends and neighbors, the economy will be that much harder to revive.
What gives you the most hope about this whole thing, and what gives you the most frustration during all of this?
Well, I mean, listen, we are very frustrated at the administration's response here. It is just not helpful when the president is on TV attacking the media who are trying to give real-time, reliable information to the public. I mean, I just don't think this president has met this moment. But what gives me hope is that inside Congress, there's really no politics here. We are working together. We are talking, frankly, more to our Republican colleagues now than ever before. And then, as I said at the outset, just the individual selfless actions that people are taking give me hope as well. The generosity that people are showing, the fact that our food pantries are full today, that gives me hope as well.
I'll let you have the last word on this, Senator.
I've been all around the state in these last 2 to 3 weeks. Hartford, New London, Milford, Stamford, Waterbury. And what I've seen of people in Connecticut, and I think it's true of people in the country, is that they're coming together, regardless of party, because they know this disease plays no favorites in party or religion or any other kind of background. And I think it's true of Congress as well, and I hope the president senses it and meets that moment.
Senator Richard Blumenthal, Senator Chris Murphy, I know I've interviewed both of you many times in the last 20-odd years, and I think this is the most significant interview we've done with both of you, so we appreciate your time tonight, and please keep us posted on events from Washington.